My name is Rusel Ardiano and I'm a sophomore at White Plains High School. Now I'm going to present my research that is based on determining low socioeconomic status effect over stress and how stress impacts anxiety and depression. Introduction and background. Stress is the body's method of reacting to a condition. This is the model of anatomy of stress inside of our head. There are two types of stressors: dependent stressors and independent stressors. Dependent stressors are things that are in our control. For example, low grades, fight with friends, and others. Independent stressors are things and events that are not in our control. For example, crime in the neighborhood or even this COVID-19. 25% of college students experience anxiety or depression each year. Review of literature. Research design have established a robust and causal association between stressful life events and major depressive episode. Anxiety is, to a significant extent, a problem of intrusive thoughts that interfere with task-focused thinking. In comparison to higher SES individuals, those with lower socioeconomic status report greater happiness at work, less self-reported stress, and less perceived stress. Cortisol, a biological marker of stress, was unrelated to socioeconomic status. Problem and goal. To know what are the effects of all types of stressors, even the effect of stress of this COVID-19. The goal in this study is to find a way of how to prevent suicide and determine what status economic is the most affected. Hypothesis. Socioeconomic status will predict the amount of stress that people experience, and stress will predict depression and anxiety. Methodology. Participants. The number of participants was 356. Total 70% of female. Were recruited from treatment-seeking college students. The ages was from 18 to 25. The males was 20.72%. All participants complete the stress questionnaire and DSM-5 Level 1 cross-cutting symptom measure. Level 2 depression and or anxiety questionnaires. Structural equation model test dependent stress and frequency and appraisals of controllability and severity as predictors of these latent factors. Cross-cutting symptoms measures. CCM is a self-report questionnaire that assesses symptoms and screens for further inquiry. Level 2 questionnaires across multiple mental health domains, depression, anxiety, somatic symptoms. During the past 2 weeks, to reach threshold for depression, participants must respond several days or greater to either CCM depression to main questions: little interest or pleasure in doing things, feeling down, depressed, or hopeless. To reach threshold for anxiety, participants must respond several days or greater to at least 1 CCM anxiety to main question: feeling nervous, anxiety, frightened, worried, or edge. Feeling panic or being frightened, avoiding situations that make you anxious, or avoiding situations that make you depressed. The result. Dependent stress frequency was associated with common internalizing, while perceived controllability was associated uniquely with depression-specific variants. Continuous stress severity was not associated with latent factors, but high severity stressors were associated with anxiety-specific variants. Table 1, this is Table 2, this is Table 3, and this is Table 4. Descriptive Statistic correlation and gender difference are shown in Table 1 and 2. Structural equation models. All regressions were conducted within the SEM framework unless otherwise indicated association between stress variables and latent factors. Limitation. Without longitudinal data, conclusion regarding temporal directionality cannot be made. Participants' appraisals of stressors should not be compared to expert ratings. Conclusion. Dependent stress frequency, controllability, appraise, and high severity and stressful events have distinct links with different dimensions of internalizing psychopathology. This suggests there may be several distinct mediating mechanisms between stress constructs and physicopathology which have potential to serve as targets of intervention. And these are my references. Thank you.